This is TTT Live. I'm DK Rosta. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Chalk City 91.1 FM, and on Facebook at TTT Live Online. We now go to Senior Corporate Communications Officer at the Ministry of Health, Al Alexander.
Good morning and welcome once again to another Ministry of Health virtual media conference, where we provide you, our listening and viewing public, both at home and abroad, with accurate and up-to-date information on COVID-19. Our panelists for today's media conference are Dr. Avery Hines, Technical Director of Epidemiology at the Ministry of Health, Ms. Michelle Ash, Chief Nutritionist and Head of the Nutrition and Metabolism Division at the Ministry, and Nurse Keisha Pravat Gomez, Infection Prevention and Control Nurse Supervisor at the North Central Regional Health Authority. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will moderate this morning's media conference. I now invite Dr. Hines to present the latest clinical and vaccination updates. Dr. Hines.
Thank you, Mr. Alexander. Good morning to my colleagues, Ms. Ash and Ms. Pravat Gomez. Good morning to members of the media and members of the viewing and listening public. The clinical update for the day completed at 4 p.m. June 22nd is as follows. If we may have the first slide, please. As at that date and time, we would have completed 218,568 tests in both the public and private facilities. Of those, 30,982 would have returned as positive, and of those positives, 22,267 are designated as recovered to date. There have been 761 fatalities, and we extend our condolences to the members of the bereaved families. There are currently 7,954 active positive cases, and those are broken down as follows: 419 in hospital, 7,170 in home self-isolation, 150 in step-down facilities, and 215 new positive cases that would have been diagnosed yesterday from samples which would have been received between the 18th and the 21st of June. There are currently 233 individuals in state quarantine facilities, and the vaccination updated as follows. Total persons vaccinated with first dose, 179,631. Total persons having received second doses of their vaccines, 45,567. A note on the vaccination and full vaccination: having received your second dose, being considered fully vaccinated, your immune system's response still needs about 2 weeks before you're considered fully immunized. So we want to encourage those who have been vaccinated, even those with their second dose, to continue to bear that in mind. And beyond the 2-week period, we still want to continue to encourage all to continue to adhere to those public health regulations, guidelines that we've been providing, because the vaccination provides just one layer in the protection of the public. The other things that we've been advising with respect to physical distancing, avoiding crowds when ill, wearing of your mask, all of these things help to add layers of protection to the population as we continue to battle with the COVID-19 transmission in the population. I'll now go on to the remaining slides of the epidemiologic update. If we may have the next slide. Okay, so the slides seem to be experiencing some form of technical difficulty, but the main important points from the epi update to date are as follows. For the month of June, we have been seeing some reduced numbers with respect to the numbers of new cases that are diagnosed on a given day. But in spite of that, we do need to continue to caution the population that the downward trend can only be maintained if we continue to maintain those public health behaviors that help to reduce spread. We have noted that there has been decreased positivity overall, meaning the total percentage of individuals whose tests come back positive has now fallen to around 30 to 32%, whereas it was at a high of about 43% during the month of May. So all of these are positive signs that all of the interventions that have been put in place have been bearing fruit. But right now, it's really important to remember a few things. Number one, while you're in your household, if you are one of the persons that is currently home self-isolating, we want to continue to encourage you to take all the necessary internal precautions, the mask wearing, the separation from the members of your family to the greatest extent possible, and the sanitization of shared surfaces. If you are having any sort of respiratory symptoms, whether you're diagnosed or not, we want to continue to encourage you to stay away from work and stay away from other gatherings. We have been having anecdotal reports of individuals who are supposed to be in quarantine coming out to do various things, errands, etc. And while we understand the necessity of getting the errands done, we do want to encourage people to reach out to support networks wherever possible to help with this activity as opposed to going out yourself, because that is one of the things that may also contribute to ongoing transmission, even as we try to battle through with the public health regulations. So in total, the epidemic situation is that there is a decreasing trend that needs to be maintained by the maintenance of all of those public health measures. I'm going to turn you over to Mr. Alexander.
Thank you very much, Dr. Hines. I now hand you over to our Chief Nutritionist, Ms. Ash, who will speak on nutritional wellness during COVID-19, especially for those persons living with NCDs such as diabetes. Nurse Ash.
Yes. Hi, good morning. Michelle Ash. So I'd get right into it. I'm the Chief Nutritionist at the Nutritional and Metabolism Division. So we'll be talking today about chronic diseases in specific with a view towards COVID-19 and nutrition. So I just ask for these slides to come up, please. Yes. So next slide. Okay, so the first thing I'd like to talk about is knowing your numbers. So this is a pretty good pictogram of basic vitals, what I would call vitals that you're looking for, particularly if you're talking about chronic diseases. Now, all of these are optimal readings, so they may not exactly apply, for example, to somebody who's been diagnosed with diabetes for many, many years. They may have different targets, for example, for their fasting blood glucose levels. It won't be 100. It might be 120, for example. However, you can still have all of your vitals checked at our various RHAs, so it is very prudent for you to keep up with your appointments as well as to still keep up with your pharmacy appointments to get your various medications so that you could stay well controlled with whatever chronic disease that you may be diagnosed with. Next slide, please. And here are a few complications with regards to persons who may be uncontrolled with their blood sugars. These are long-term diabetes complications. You may heard of some, such as glaucoma, cataracts. They may have diabetic foot, loss of limbs. In terms of kidney damage, they may go on to chronic kidney disease, as well as renal failure, strokes, heart attacks, and what they call neuropathy of the periphery, which is like your hands and your toes, etc. Next slide. Okay, so here are a few symptoms of diabetes. These are very important to take note of. Some persons may not exactly have access to check their blood sugars at home. However, you can know a few symptoms of when your sugars may be high. Example, you may be always thirsty, always dropping asleep or tired for no apparent reason, blurry vision, sexual problems in males, they're not able to perform, wounds that won't heal, numbness or tingling in the hands and feet. They may get yeast infections for females. You may be not getting a restful sleep because you're always getting up to go to urinate in the night, always hungry, although you may have eaten a satisfying meal about an hour ago. And end stage in terms of progression of diabetes, weight loss, and this is loss of muscles. So not exactly the best weight loss that you're looking for. Next slide, please. And just to note that this is actually the year declared as the International Year of Fruits and Vegetables by the UN. So this is just one thing to note, and it will be the theme for the rest of this presentation. Next slide, please. Okay, so in terms of prevention of colds and flu, one statement that I would like to make is that there's actually no single food or no single ingredient or a supplement that actually has been proven to prevent COVID-19 or treat with. It is a holistic approach that we have to take in terms of creating a healthy, balanced diet to support a strong and healthy immune system. So we're taking a whole foods approach with regards to prevention of colds and flu in general. So we do know a few things in terms of cold and flu. A few key nutrients of concern are zinc, vitamin D, and vitamin C. Zinc you can actually get from a lot of food sources such as seafood, meat, chicken, fish. All of those are very high in zinc. You also get a bit of zinc from nuts and seeds as well. Vitamin D, you really don't need to take a supplement for vitamin D because you could just walk outside in the sun 10-15 minutes and you get that nice vitamin D being that active form being manufactured in your body. There are a few food sources as well, such as egg yolks and fish. And vitamin C, in terms of this, only 90 milligrams a day is really needed for most adults. And you could get that very easily if you eat one orange for the day. That's actually all the vitamin C that you require for the day. And we have a plethora of high vitamin C fruits available in our country. One of the best known sources and richest sources of vitamin C is the West Indian cherry. Just about 10 to 12 cherries will actually give you about 1,000 milligrams of natural vitamin C. And your body will tend to use natural sources a lot better than supplements. Okay, next slide, please. So we're talking the 6 food groups for persons who may not be familiar. This is some persons would have done this in school days, so we're back to that. So the staple foods, vegetables, fruits, food from animals, fats and oils, legumes and pulses. So what we would like to focus on is having a combined minimum servings, 5 servings of fruits and vegetables as recommended by WHO. Now, the last risk factors survey that we did within Trinidad and Tobago, called the STEP survey, that was in 2011, I believe, 91% of Trinidad and Tobagonians were only consuming, well, they were not consuming as much as 5 servings a day. They were not even barely meeting that recommendation. So nationally, we do have some work to do. Next slide, please. We would like to emphasize a diet rich in fiber, nuts, seeds, healthy fats. Twice a week, we recommend fish to be consumed, and this could be any type of fish: tuna, sardines, what we call locally as fry dry. This particular diet actually helps to support the immune system as well as reduce any inflammatory factors that might be occurring in the body as a result of infection, etc. So, for example, if you're preparing your body for vaccination, if you haven't overhauled your diet just yet, this is a really good time to get your body prepared to receive the vaccine. Ensure that you're getting a lot of fiber from oats, black seeds, peas and beans, ground provisions. Next slide, please. So, high fatty, sugar, and salty foods. So, the pandemic is a time where a lot of persons are very highly stressed, and we resort to stress eating. And it usually results in gravitating towards these type of comfort foods. So what we like to recommend is that we be more mindful as to how many times did I go to the fridge this morning? How many times did I go to the cupboard looking for food to graze? Right? When we may have just eaten a meal, breakfast, lunch, or dinner, and we wish we should have been satisfied. So a good thing to do is, because sometimes we're bored as well, so some of it is that, distract the mind, right? Distract the mind, maybe go to do something else, clean a room, read a book, go garden, etc. So it's about being mindful and then being present in the moment. Next slide, please. So reading food labels. I would just touch very lightly on this topic. Most of us don't turn the back of a food package to see what we're putting into our bodies. This is just to be aware that 2 key things that you're looking for. The black and white panel is called the Nutrition Facts panel. It actually has all the nutrients of concern, good and bad, that you're looking for. So it's very good to get acquainted with that. The Other thing that you're looking for is the ingredients list. If you're picking up a food that's supposed to be a simple food, make sure that the ingredients are also simple. It should not have something like 30 to 100 ingredients listed on that listing there. Next slide, please. Added sugar. So when we're talking added sugar, we're not talking sugar from sources such as natural fruits and vegetables. With their natural sugars, we're talking about things that you have added during preparation or that you would have added during the cooking process. So anything consisting of white sugar, brown sugar, any type of syrup, agave syrup, condensed milk, molasses, all of those things add sugar calories. So for example, for men, is recommended no more than 9 teaspoons daily. Women do not exceed 6 teaspoons daily per day. Next slide, please. Sodium and salt awareness. Very important for those who are trying to manage their hypertension, their high blood pressure. So the recommendation for persons, especially with chronic diseases, is about 1,500 milligrams per day, which is very feasible. And that is about 2/3 teaspoon of table salt. And we have a nice pictogram here showing high sodium containing foods. Some of us may know it's high in sodium. For example, if you like a lot of red mango preserved products, those contain a lot of hidden sodium that we don't exactly taste with our tongue. Next slide, please. Practicing mealtime portion control. This is especially true for persons who may be living with diabetes. This will help them to have a little bit better glycemic control. And what we normally advise is, particularly for your lunch and your dinner, portion half of your plate in vegetables, portion quarter of your plate in starches, and then the next quarter will be allocated to high protein foods such as meat, fish, peas, and beans. Next slide, please. And snacks. What can I eat that's healthy? We have a list of 100-calorie snacks, mostly fruits, vegetables. If you're looking for a different type of mouthfeel, you can get creative. You can roast chana instead of buying you fried packaged things. A quarter cup of roasted chana is actually just 100 calories. If you don't add a lot of oil, air pop popcorn, you can eat as much as 3 cups of popcorn, and it's just 100 calories. And 2 servings of West Indian cherries will give you just the same as well. And it makes a nice sorbet as well. Nuts and seeds are very good snacks as well. Next slide, please. And we must touch on alcohol. Now, excessive consumption of alcohol actually depresses the immune system. So this is why I would like to touch on it. Now, if on a weekly basis you're consuming, for men, more than 2 drinks a day, and for women, more than 1 drink a day, this is actually considered excessive or binge drinking. So we advise very much to practice moderation, or if not, limit most of your alcohol consumption, especially during this period. Next slide, please. Water. For adults living in the Caribbean, about 2 to 2.5 liters of water is what is generally recommended. Some persons may have different recommendations based on their activity level, how long they're in the sun, etc. But generally, this is what is normally advised. And we're not advising to hydrate via sugar-sweetened beverages. That is something that could be consumed maybe only on an occasional basis only. Next slide, please. And exercise, we're touching on this a bit. During periods of lockdown, etc., WHO has a guideline. So daily, we should at least be getting 30 minutes of exercise as adults. For children, at least 1 hour daily of exercise. And there are a plethora of resources available online. There are things that we can do that are fairly low cost, such as skipping rope. And at least twice a week, we should do some type of muscle and strength training. Next slide, please. Okay, and this is my last slide. This is just to really get an idea as to how much work we actually have to do exercise-wise. If you do like to eat your 2 pieces of fried chicken, you would actually have to walk for about 1 hour and a quarter to burn this off. If you do like things like soda, soft drinks, 1/4 of an hour you have to walk for to burn this off. If you like ice cream, you like a cup of ice cream, you have to walk for 45 minutes at least to burn off these calories. So these are just some little tidbits. So everything has a balance. And with that's my last slide there. And I would like to thank you for letting me impart some of the information today with regards to wellness and chronic disease management and prevention. So I would be available as well for any questions. Thank you.
And thank you very much, Ms. Ash. Nurse Pravat is no stranger to the Ministry of Health and, of course, to the COVID-19 updates. And at this time, she will be speaking on guidance on following COVID-19 protocols, as well as why it is important for medical first responders like her to be vaccinated. Nurse Pravat Gomez.
Good morning, panel members, also to the viewing and listening members of the public. I am here this morning to share with you my experience thus far on being the first person in the country who have been vaccinated just over 4 months ago on the 17th of February. I personally felt confident going through with being vaccinated, and for me, the side effects were very minimal. I am now fully vaccinated, as with other healthcare workers and some of the more susceptible persons in our community. But in no way has that stopped me from taking the necessary and required precautions, such as the 3 W's. It is important to note that building immunity takes time, and you are not considered fully vaccinated until approximately 2 weeks after your second shot. In order to continue protecting our loved ones, we must wear our mask, ensuring that it covers both our mouth and our nose. When adjusting the mask, this should be done at the sides of the mask. At no point in time should someone come in contact with the front of the mask. Adjust the mask at the sides nearest to the air loops, and sanitize your mask immediately after. If you must remove your mask, go to the air loops, remove, and store your mask properly in a safe space. If your mask should be discarded, you can do so at this point, making sure to sanitize your hand after you come in contact with the mask. Hand hygiene is also very important. This involves hand washing and doing so for approximately 30 to 40 seconds, ensuring that all surfaces of the hands is thoroughly washed. After you rinse your hands, you might dry with a paper towel and discard the paper towel immediately after. Hand sanitizing when hand washing is not available can also be done. This should be done with an alcohol-based sanitizer comprising of an alcohol percentage of no less than 70%. For example, if you're in your car or if you're on your desk and you can't access the hand washing at that point, you can use the hand sanitizer at this point. It is also important to watch your social distancing from co-workers, friends, and family who do not reside at your home. Once it is possible and practical, try to maintain that 6 feet distance. Once you are on lunch, especially in the work environment, it is important that you take turns. In the lunchroom, sanitize all surfaces prior to having your lunch and after having your lunch. Immediately after eating, you must put back on your mask and sanitize your hands. Currently, we are focusing on vaccinating the more vulnerable members of the public. Those would include persons 65 years and over, as well as persons with comorbidities. As such, we all have to do our part, and we can, in the short future, see a country returning to some level of normalcy. I would lastly like to implore all healthcare workers and persons who fit the criteria to be vaccinated currently to go and do their part, as together we fight this common threat. Thank you.
Thank you And thank you very much, Nurse Pravat Gomez. We now move to the question and answer segment. We remind our media representatives that they should state their name and the media house before posing their questions to specific members of the panel. A maximum of 2 questions will be fielded for each media house in the first instance. Media representatives are reminded to please keep your questions as brief as possible so that your colleagues will also have the opportunity to pose their questions within the allotted time. We begin with 98.1 FM. Good morning, 98.1.
Good morning to you, Mr. Alexander. Stephen Cummings, 98.1 FM. And as per usual, thank you so much for allowing me the opportunity to pose my questions. Just 2 questions quickly, and I would most likely direct those to Dr. Hines. Dr. Hines, I continue as well to get questions, coming to me from members of the public, listeners to my program, and one of the questions has to do with the person says, what is the status of an employee who received a quarantine release but later tested positive after a private testing was done? Can that employee still infect others? And this is basically a verbatim question from one of my listeners, callers. And there's another question here again. What is the status of, with respect to quarantine persons, those who have been given approval to return home, repatriated persons in particular, those persons who are fully vaccinated? Now, I know that the Minister of National Security at one time was on the program talking about the status of repatriation, and so I'm not sure if Dr. Hines, you are able to address that. If not, that question can also be passed on to the Minister of National Security. Thank you.
Okay, Mr. Cummings, we missed a fair portion of what you were saying at the start because I believe you were muted. I got the what is the status of, but I don't quite know in relation to what you're asking about. Can you just restate that question quickly, please?
Both questions.
Yes, I was referring to the status of quarantine persons who have been quarantined and been given approval to return home, the repatriated persons in particular. I'm not sure if you got that question.
I got the question, but I'm still querying status in respect of what? Those who have returned, those who have received exemptions and have returned have been put into the routine quarantine facilities as the current policy dictates. There hasn't yet been a change in that, and if there is a change, then that change in policy will be notified via one of the levels of press conference, either this one or at the level of the Prime Minister's press conferences. If you had another question, i.e. a first question, we also didn't hear that. Apologies.
Okay, I'll come back with that other question at a later time.
Thank you very much, Dr. Hines. We now move to TV6. We are ready to take your questions.
Hi, good morning to the panel. Alicia Boucher from TV6. Dr. Hines, you would have mentioned a little while ago reports coming to you of persons leaving their home while they are on quarantine orders. Now, we've also had similar reports. And in one instance in particular, it was stated by that person within law enforcement that they were given an exemption to break their quarantine order, to go out and do activities that they would have considered as necessary. And I was wondering, has the Ministry of Health given any exemptions for persons to break the quarantine? And if so, how many, and the circumstances under which they've been given that exemption? That's the first question. Second question is, can we have an update on the variants in the country, if you are able to give an update on that? I know a few weeks ago it was stated that the P1 variant is the dominant strain. Do we have any cases of the UK variant here right now? Thank you so much.
Okay, thank you for the two questions. To the best of my knowledge, there have not been any formal exemptions granted by any branch of the Ministry of Health to breach quarantine, for the simple reason that the mechanism of quarantine is one of the key mechanisms to preventing transmission. So I'm not aware of any such exemptions being granted, so there wouldn't be numbers associated with that. With respect to the variant, now again, I'm taking the opportunity to clarify that at the press conference where Professor Carrington addressed that variant proportion, she did indicate that the proportion of variants that were found in the samples tested does not necessarily represent the proportion of variants circulating in the population. So while the predominant strain in the samples received may have been variants of concern because of the sampling strategy, meaning the search for additional persons who may have contracted the variant of concern so that we can make more efficient measures around prevention of spread. That strategy would skew the proportions of variant versus non-variant that you'd find in the samples received by the university. That being said, the introduction of a variant into a population comes with the natural establishment of some form of equilibrium, meaning some proportion of the circulating virus then is attributable to the variant. We're still in the process of acquiring both the capacity and the resources to do broader and more representative sampling of the population to give a better idea of what the dominant strain is at this point in time. So we don't have a breakdown of proportions of variant versus not in the general population at this juncture. Again, to emphasize that the presence of the variant is not so much the issue as the stringency with which we adhere to the public health measures. What we know about the variant is that it is more transmissible, and therefore we need to be even more stringent with the adherence to the public health measures in order to reduce the risk of spread. What we've seen is that in households, we've seen more transmission in the recent times as opposed to back in September or October, and if the increased transmissibility of a variant is part of that milieu, part of that scenario that increases transmissibility in the household, again, the measures that we just spoke about with respect to infection prevention and control, even within the household, those measures become even more important in the reduction of the risk of transmission. So that should really be the key takeaway with respect to the presence of variants and how we respond to them. I believe we answered both aspects of the question.
Yes, thank you very much, Dr. Hines. We now go to CL Communications.
Hi, good morning. Natalie Singh, Caribbean Lifestyle Communications. I was just wondering, last year, the statistics of death for H1N1 cases were hovered around 40, maybe 47, somewhere there. I was just wondering, this year, has a determination been made concerning the statistics for H1N1 cases, and more so H1N1 cases concerning deaths? I haven't heard any mention of that in any of the reports. And then my second question is concerning quarantine and concerning persons who are in quarantine. What measures are in place to prevent those people who are breaking the quarantine rules to kind of stop that action then? What sort of control measures do you have in place for that to prevent it? Thank you.
Okay, thank you. I don't know if you were present at the press conference where I believe Sunalala had asked about the testing for H1N1, and we indicated at that point that the testing capacity, that genomic testing capacity for respiratory viruses was basically, for want of a better word, taken over by the testing for the large volumes of COVID samples that we received, so that there hasn't been the same level of determination of the other respiratory pathogens in the time frame, given the fact that it's the same resources that would need to be used to determine either or. So priority was given to the current public health threat. At some point, that level of testing will resume and the additional information will become available. With respect to the quarantine enforcement, the first level of enforcement really is that level of personal responsibility that we expect that responsible, right-thinking adults will maintain in preventing themselves from transmitting illness to other people. The second level of that enforcement is the fact that we do have, as the quarantine order is a legal order, we do have access to the support of the TTPS in enforcing quarantine where need be. If individuals have been identified as breaching quarantine, the TTPS can be brought on board to bring some sort of prevention and enforcement to that behavior. We're hoping that that's not the main mechanism to which we have to have recourse, but that option is available to us, and it has been used in the past and continues to be used in select cases.
Thank you, Dr. Hines. We go next to IETV.
Hi, good morning. Bina Mahis, IETV News. I have two questions. My first question would go to Dr. Hines. Dr. Hines, a 64-year-old woman called us to say that she applied some 6 weeks ago via the text message system for her vaccine. She did not receive any sort of correspondence. So she went to a health center within the NCRHA to register for the vaccine. They turned her down saying that she's 64 and a half, not 65. And she cannot get the vaccine. So is it strictly 65 years and older? Because she claimed to have seen some younger persons there as well. My second question would go to Ms. Ash. As a nutritionist, do you recommend home remedies, for example, teas with various ingredients like saffron or honey or ginger for the treatment of COVID-19, as many persons are confident that this is a solution and remedy for the virus? Thank you.
Okay, thank you for the two questions. At this level, we aren't able to comment on sort of the operational aspects of vaccine delivery at site. We do know that the current policy, the current target group is still the 65 and over. And when that expands to additional groups, then we'll make that known. But in respect of responding to a particular case, this is not the level at which we could give an answer to that. That may be something that can be answered at the RHA level.
Okay, and I will answer the other part of it with regards to teas, herbal remedies, so on. In terms of, I heard honey being mentioned, as we had in the presentation earlier. That is also considered a source of added sugar. So if you're using honey, yes, although it also has some nutrients associated with it, it still adds a lot of sugar-based calories to your overall diet. So that and sugar will send up your blood sugar levels, particularly if you are a person living with diabetes. Second part of the question, herbal remedies. You have to be careful with some of the remedies in terms of the dosing of them. There are actually some herbal remedies that actually may be harmful to persons, for example, with autoimmune conditions such as lupus, etc. Overuse of things like echinacea for certain autoimmune conditions might actually be a little bit harmful for them, as well as excessive use of garlic in certain conditions as well. So there's a lot of medical nutrition therapy that goes behind in some of the treatments. So if you do know that you have any special conditions, you should really consult your healthcare professionals, your team, to ensure that you're not doing anything that will be harmful to your immune system, for example. But we did grow up, this is also a cultural thing that we do drink, for want of a better word, various bush teas, etc. I would caution with the fresh bush teas, unless you know exactly what you're doing. So nothing is wrong with a little bit of green tea every now and again, a little bit of turmeric or saffron tea, once again, that might contradict with certain medications, certain persons who may be on any type of medication for cardiovascular conditions, so caution with certain things. So in particular, watch out for echinacea, turmeric, garlic. There are certain persons who, if they overdose on those things, can be quite dangerous. So it's not totally harmless, these herbal remedies.
Thank you for the question and excellent response. Thank you so much. We now move to the Express. for your two questions.
Hi, good morning, everyone. Kay Marie Fletcher, Trinidad Express. My both questions this morning will be directed to Dr. Hines. Mexico's foreign minister announced that Mexico will be donating vaccines to several countries, including Trinidad and Tobago. So I want to know if it's possible to be able to confirm this, let us know when we'll be receiving donations and how many doses. And my second question has to do with COVID deaths. To what extent is the Brazilian variant a factor in the mortality rate? We've seen for May a high number to 326 deaths, and so far for June, 266 deaths. Are we seeing that the Brazilian variant is contributing to this? Thank you.
Okay, thank you for your questions. With respect to donations from foreign countries, those announcements would come via the relevant ministers, the Ministers of Foreign and CARICOM Affairs, and the Minister of Health, or the Office of the Prime Minister, with respect to what is received, what is offered, doses, etc. So when that information becomes available, if it becomes available, it will be announced at those levels. With respect to the deaths and the variant, as we said a moment ago, we are aware that the variant itself is more transmissible than some of the previous versions. And to the extent that it is more transmissible, it also contributes to larger numbers of cases resulting in a proportion of deaths that generates larger numbers. So while the proportion of deaths will be around 2%, if you have 2% of 13,000, that's a large number. And given the number of cases that have been generated, you're seeing those additional numbers showing up among the fatality statistics. But it's not necessarily because of the additional virulence or pathogenicity or disease causingness or severity of the illness caused by the variant, so much so as the fact that there are just a lot more cases at this point in time. And even as the cases go down, as in the new cases go down, we do note that there's still a significant number of active cases, meaning cases that are still under monitoring and treatment. There's a significant number of hospitalized cases, meaning people who are more severely ill, so that you will see inevitably that there will be a proportion of those who do have fatal outcomes, although every effort is made to have the best outcome in each individual case. So I'm hoping that does answer the question that has been asked a few times before.
Thank you very much, Dr. Hines. We now move to Power 102. You can field your two questions. Power 102. Okay. If Power 102 is not ready, we'll move to CNC3. Guardian Media
Good
Limited.
morning, Annalisa Paul, Guardian Media Limited. Dr. Hines, my two questions are for you. First off, in terms of dispensing the vaccines, there are persons who are asymptomatic who may present for a vaccine. Are persons being tested in this case to make sure that you do not have the virus before you receive that vaccine, firstly? And secondly, with the two confirmed cases of VITT that we have in the country, how are you all detecting this? How are you all treating it? And CMO had mentioned on Monday that it's 4 in 1 million in terms of persons developing this condition. Yet still, we're seeing 2 cases out of 100,000, however many AstraZeneca vaccines we have so far dispensed. What does this speak to in terms of our risk and our probability for our population? What does it mean for us if we're looking at international studies showing 4 out of 1 million, yet we have 2 out of however many here? Thank you.
All right, so the question about testing prior to vaccination has been asked several times. The answer has not changed. No, there is no testing that is done prior to the dispensing of a vaccine. We do have a screening questionnaire that asks whether people have symptoms. You pointed out that some people may be asymptomatic. We're aware of this as well. But the testing resource is not directed towards the testing of people who present themselves for vaccination. We are relying on the ability of people to identify their symptoms to reduce that probability. But testing is not done at that point. With respect to the VITT, now the identification is via various clinical means, and I believe that at some point there will be additional clinical description of that by the relevant specialists. The occurrence of 2 in the number of people that we have is basically what we call random. When they say 4 out of how many of a million, it doesn't mean that you have to count to 1 million before you get 4. You can get the 4 early and then get no more. You can get none until the last 4. It is a random occurrence. So at this point, with the small numbers that we have, there isn't anything that we can say about our particular risk, but we continue to monitor the situation. We continue to monitor the occurrence of these cases. And as additional data becomes available, we'll be able to have a better position with respect to risk of occurrence in our population.
Thank you very much, Dr. Hines. We now move to radio tampering.
Good morning. Peyton Clark, Radio Tamron. 2 questions. The lady who spoke on the nutrition, I didn't get her name. Just want to find out, I know you said that the whole issue of diet and the COVID-19 is a holistic issue. But has there been any study or findings on the impact of diet in either reducing the risk or helping recovery with respect to COVID-19? And my second question, with regards to persons who have not been staying at home on quarantine, what is the latest in the use of braces? We see other Caribbean countries employing the use of braces to monitor persons on quarantine. What's the latest with that in Trinidad and Tobago? Thank you.
Okay, so Ms. Ash, would you take the first question, and then Dr. Hines will take the second?
Yes, I'll address the first part. In terms of research that's being done right now, I cannot confirm right now that there are extensive studies being done right now. However, we know internationally there are a few things that are currently in the works with regards to specific medical treatment in terms of medical nutrition therapy. So all the time we are getting updated information, for example, from North America, as well as other parts of different continents. We are getting information that assists our treatment and care practices here locally as well.
Thank you.
Okay, and with respect to the second question, various methods for enhancing our ability to monitor persons on quarantine continue to be explored, including the electronic monitoring methods to which you're referring. As additional decisions are made on those decisions will be brought to the public at the various levels, whether it's at the level of National Security Office of the Prime Minister or at this press conference. So you will be updated when additional decisions are made on that score.
Thank you, Dr. Hines. We will now field questions from the Newsday.
Hi, good morning. This is Paula Lindo from the Newsday. I have 2 questions, both for Dr. Hines. The BBC, in an article published yesterday, said Trinidad and Tobago is one of quite a few countries that's running out of vaccines. Would you be able to give us an update of the number of vaccines we have on hand right now? And this second question is related to one that you answered a little while ago, but with a slightly different twist. Someone said that they were quarantined with a COVID-19 patient, a COVID-19 positive person, and they don't have any symptoms, but they want to know if they can still get their second dose at the same time that they were scheduled to, or if they should get tested. They said they were told they couldn't get tested because they don't have any symptoms, but with the proximity, they're wondering. Thank you.
Okay, thank you for your questions. I'm not sure exactly what criteria we used for the term running out of vaccines. Now, the country has received several shipments of vaccines. As the shipments come in, they are utilized, and they're utilized in a strategic manner so that the first set of vaccines that is distributed is half of the total, so that you ensure you have enough vaccine on hand to provide second doses for everyone who has received a first dose. So as you approach that limit, then there may be a pause in the rollout while additional vaccines are sourced, so that you don't run out of second doses for individuals who have already received their first dose. But that doesn't equate to running out of vaccines. We do know that there are additional shipments of vaccines still scheduled to come in. So the store that we have, the stock of vaccine that we have, is being managed as it has been, as has been described. We are not currently experiencing any difficulty with that particular aspect of the rollout. Now, the second question you asked is actually quite an interesting one. An individual who has been quarantined with a COVID positive person does not have symptoms and is now querying whether or not they can go for their vaccine. There may need to be some sort of discussion with them and the CMOH office to determine the level of risk of them being positive in spite of the fact that they have no symptoms. So there'll be additional assessment that will be done with respect to how much risk prevention there was, the situations within the household, etc., that would determine whether they are high or low risk for being infected and whether they do need to actually follow up with testing or can go ahead and do their vaccination. It's not something that we'll be able to advise on without that information at the level of the press conference. That's a conversation they will have at CMOH level.
Thank you, Dr. Hines. We will now field questions from AZP News.
Hi, good morning. Private Harry, AZPnews.com. Dr. Hines, people are asking when they get an exemption to travel, do they have to carry their immunization card that they have now, or do they get another card from the Ministry of Health? You just need some advice on that. I don't know if you can clarify that. And secondly, in terms of the cases and the deaths, they seem to be on a downward trend. Do you think that that is sufficient enough for us to see some relaxation of the measures right now? Thank you.
Okay, thank you for your questions. There is a travel document called an international immunization card that is utilized for documentation of yellow fever and other internationally required vaccinations. There is not yet a position that COVID-19 vaccine is required for travel. So the use of the international card versus the normal immunization card still is really a matter of choice at this point in time. We do note that some states do not recognize whether you are vaccinated or not in their treatment of you of the quarantine procedures coming in. Separate thing. It doesn't actually prevent you from being able to travel, but it does then dictate what happens when you arrive on the other side. But at this point in time, without an international recommendation or requirement to put COVID-19 in the international card, it can go either way. Just work with both if you have both available. With respect to the second question, as we always say at this level, all decisions on relaxation, etc., decisions that are made by the Honorable Prime Minister and will be advised from that level. As we're seeing the downward trend, what we do want to recommend or to recognize is that this is not the time to feel, okay, we can mentally relax or relax on the adherence to the measures that are currently in place. When and whether those measures are relaxed, that is a decision that will take place at prime ministerial level. In the interim, what we need to do is not relax our adherence to the existing measures.
Thank you very much, Dr. Hines. We do have a little time for a few more questions. So now we will take one brief question at a time. We now go to TV6.
Hi, Dr. Hines. My question is for you. There are studies out there right now in relation to ivermectin being used as a management drug. I know there's no cure for COVID-19, but as a management drug to preserve lives. And I was wondering, has health officials been, considering this? And do you have any advice for the population who may probably try to source ivermectin to use? Thank you.
Okay, thank you. That question does keep coming up, and at the level of the WHO, there is still a level of interest in pursuing the studies to see whether there is an actual benefit or not. There have been several small studies that go in either direction with several caveats in terms of the applicability, reliability, of the studies with their small groups. The WHO has its own technical advisory group that is looking at and reviewing all of that information, and if and when that recommendation becomes something that is endorsed by the WHO, then additional consideration will be given to whether that's implemented in our national setting. At this point, that recommendation hasn't come from that level, and therefore we continue as we are at this point in time.
Thank you, Dr. Hines. Power 102. Your follow-up question, please.
Good morning, Sparkle McIntosh, Power 102 Digital. My question is for Dr. Hines. As at June 21st, TNT was placed 13th globally in the number of deaths per million. What are the main contributing factors for this high death rate per capita? And in addition to this, of the patients who would have died within the last 7 days, can you indicate what percentage would have died at hospitals, in HCUs, ICUs, at tents, and even at home?
Okay, thanks for the question. Now, our death rate per capita isn't specifically or spectacularly high. We do have a case fatality rate that is somewhere in the vicinity of just above 2%, which is still in line with the global figures for case fatality. What we have noticed, however, is that we did have some infiltration into certain vulnerable populations. A couple elder care homes did have additional cases. And as was seen in international situations, once that happens, then there are additional fatal outcomes because of the age group and comorbidities of the people affected. So that may, to some extent, contribute to some of the increase that would have been seen. But at this point in time, the case fatality rate is still basically in line with the global average. With respect to your second question, at this point, no. The information on the disposition of the patients that would have passed on in the last 7 days is not information that we currently have collated in front of me, but we are currently reviewing and collating that information, as well as other background information on the distribution of cases throughout the system. So when we have additional statistics to report, we will include that in one of the upcoming press conferences.
Okay, we quickly move to 98.1, yes, for your follow-up question.
Yes, thank you again, Mr. Alexander. Question to Dr. Hines. Dr. Hines, do you know if our status, our WHO status, has changed in any way? I know at one time we were categorized as being at community spread level, and I haven't heard in recent times where we are in terms of our categorization. And I know that one of the objectives of the ministry was to bring us back to cluster. Can you give us an update as to where we are on the WHO ranking in terms of spread?
Okay, important point to note. The WHO ranking is the ranking given by the information we provide to the WHO. We have currently not changed out of the status of community spread since the last time we spoke about it. I believe that the actual distribution of cases, the number of cases that we see on a daily basis, would support that. There hasn't been any indication of any evidence to change in any direction at this point in time. As the cases continue to go down and as we look at the distribution, if and when we meet any additional criteria for changing that designation, we will advise the WHO, and then that information will be reflected in the WHO's ranking.
Thank you very much, Dr. Hines. We have come to the end of today's COVID-19 update. We thank our panelists, the media representatives, and you, our viewing and listening public, for sharing your time with us. Please note the vaccination rollout continues in all RHAs for persons 65 years and over, and for those with appointments for their second jabs. Remember, you are considered fully vaccinated 2 weeks after your second jab, and even though you are fully immunized, as Dr. Hines would have mentioned, you still need to practice the 3 W's to continue to protect yourself and others. That is, wash your hands, watch your distance, and wear your mask. Have a good day, everyone. Stay safe, and goodbye for now.
I solemnly pledge to dedicate my life to the service of my God and my country. I will honor my parents, my teachers,